whenever you are.
So welcome to the show, Dr. Watwood. I'm so glad to have you, Anne.
Thank you. Thank you for inviting me on.
Yes, so we were supposed to be on your podcast today.
Yes, we were.
And for any of you that want to listen to that, the information is in the show notes. It's called What Would Larry Do? Although it's really What Would Anne and Larry Do? So, Anne Watwood, Larry Hellwood, they have a very successful practice in Phoenix, Arizona, and it's sort of the go-to place for anything aesthetic, cutting edge, especially when you're dealing with lasers. They train people from all over the country and all over the world there. And I always like to discuss top technologies and top aesthetic procedures for 2022. But I think we're going to hone in today on PRP, PRF, and other things in that area that are new on the horizon. So can you explain to everyone listening, what is PRP? What is PRF? People have probably heard the words PRP in particular over the last few years, but what exactly is it?
So PRP and PRF, most people might be more familiar with the word PRP, which is platelet-rich plasma. And again, so any of the people out there who have seen those reality TV shows, I think Kim Kardashian was one of the ones who made it super famous, where they draw your blood, they spin it down, and then they put it back on your face. There's also popular companies that have the terms coined, like vampire facelift or vampire facial. And that's what PRP is. So basically what we're doing is we're drawing your blood, we're spinning it down to get rid of the red blood cells, to concentrate the platelets and the white blood cells, and then you put it back on any open tissue that needs to be healed, or you can inject it into tissue, because what it's going to do is attract our body's immune system to heal that tissue. So whether it needs collagen, or, other people might be familiar with PRP because sports players who have injured joints will have it injected into their joints to heal that tissue. People like Tiger Woods have had it done. So PRP has been very popular. And then the other aspect is dentistry. So anybody who's had to have a tooth implant, where they had to remove your tooth and then they put in that bone graft, they actually put PRP in with it, or PRF now, to get that tissue to take. And then that has to go for a couple months before they add the regular tooth onto it. And so that's where PRP began, is basically trying to heal tissue. And then PRF is new, but not so new. It's just more new to the aesthetic world. The dentistry world, it is not new. And they have actually switched to that like 10 years ago. And the basic difference is with PRP and PRF, so platelet-rich plasma versus platelet-rich fibrin. And the biggest difference is there's no anticoagulant in it in the PRF, and that strips out the fibrin matrix. And I like to describe the fibrin matrix to my patients as like a fish tank. So if I pull a fish out of the ocean and I slap him on the counter, he's going to survive for a few minutes. That's kind of like our PRP, where all those white blood cells and growth factors are going to survive for a few minutes to a few hours, and then they'll die. Versus if you take a fish out of an ocean and you slap him into a fish tank, but you don't feed him, he'll survive for a few days. And that's where PRF, all these white blood cells and growth factors are going to survive for 7 to 12 days and keep producing, versus 30 minutes to 3 hours. So the number one main difference is the cells survive longer. The number two difference is that there's a higher concentration of the white blood cells and the immune cells in it versus PRP. PRP tends to have a 4 to 8 times concentration. PRF has a 10-time concentration.
Okay, so let's just take a step back there. So why are the platelets and the white blood cells so important?
So this is how our body heals. You have your immune system, and anytime you get cut, so let's say, a cat scratches you, you cut yourself with a knife, your body's going to respond to that to heal and close that wound, because number one, you don't want a bacterial infection. So the white blood cells show up and they have multiple functions. And I'm not going to get into each little individual guy because that's complicating, but you have the ones that come in and their job is to kill bacteria. And they go in, and I call them the Pac-Man. They just clean out all the trash. Anything that is dead tissue or bacteria, they're going to get rid of it. Then you have the guys that come in behind them, and they're there to, basically put everything back together. So this is the part of the immune system that we're attracting to areas that we want, because we're attracting the cells that are there to put everything back together. One of the primary immune cells, it doesn't matter if you're doing aesthetic treatments or if your arm gets cut by a knife, these little guys show up and they deposit collagen, because collagen will sew your wound shut. So if you get cut open by a knife, what closes that and creates that scar tissue is collagen. It's those little cells. So what we're doing is attracting a whole bunch of them to the area, but since there's not a big wound cut open by a knife, they deposit a bunch of collagen, which just increases the collagen in our skin that we've lost and helps with the anti-aging.
Okay, that's amazing. So it sounds like what you're talking about, if this was the first time I was hearing about PRP versus PRF, it sounds like PRF is sort of like the 2x mega version of PRP. Are there any times you would want to use PRP over PRF? Like when would you either, or do you just prefer PRF overall and think that it should always have been in place of PRP?
That would be my opinion, is that I only use PRF. There really isn't a reason to nowadays. There's two things that people will claim as a downside. One, there's a slightly higher percentage of red blood cells in PRF, but it's only 1% to 2% difference. If you are drawing it up wrong, which is 100% technique dependent, you can get too many red blood cells in, but all that has to do is don't get too close to the red blood cells and suck them into the syringe. So that's pretty easy. So number one, that's easy to fix. Number two, it clots quickly, meaning you would have to inject fast because there's no anticoagulant in it. However, they have created systems now where you put it into a cooler and it stops the clotting process. So you have up to an hour to inject it. So that short injection time window has actually gone away. So that was one of the big downsides that people didn't like, is that you had to inject it so quickly. That is now not a thing anymore. So for me, I don't really see the benefit of PRP versus PRF because I'm getting more cells that are going to stay alive longer and keep producing. I don't have to worry about the quick injection time. And as long as you're trained how to do it properly, which is very, very simple, you won't end up with too many red blood cells. And then there's one other thing I want to say though, too, for anybody who's truly wanting a treatment that's 100% natural. Number one, PRF, we haven't added a drug that's an anticoagulant to it, right? Because that's a foreign substance. Number two, there's that little stopper in the tube that separates in PRP, not in PRF, separates the white blood cells from the red. It's that little like wax almost stopper. When they've done tests on some PRPs, they found microscopic amounts of that stopper in the PRP, which is a foreign substance being injected.
Okay, so just to get into the nitty gritty a little bit, explain. So basically, if you go to someone's office and they're offering PRP, they are able to offer PRF because it's blood. It's just a little bit of a different procedure. Can you get into the science a little bit on that?
Yeah, and it's not too much. One, it has to do with the centrifuge. So the centrifuge has to have, so when we draw your blood, we put it in little tubes, and the PRF has it at a very specific angle and it spins at a slower speed. But otherwise, if you have that centrifuge versus another one, all you have to do is draw their blood and you put it in a tube that does not have the anticoagulant and does not have that little wax stopper in it. And that's just the main differences. So any office who offers PRP could simply offer PRF, but you do have to have the slight change of the tubes and the centrifuge.
Okay, so it sounds like it's more natural, it's more effective. And then what are the indications that you do with it? I know you did under my eyes, and it was very nice. Over the years we've been doing fillers under the eyes, and I've never been really happy with those because I feel like they migrate. So typically we'll inject hyaluronic acid filler, and it seems like 4 years later or 5 years later, it's migrated. And from across the room, I can see the blue puffy area at the line at the height of the cheekbones in most people, even if it was satisfactorily placed right away. So I think this is a great indication of hollowness under the eyes. I've been very pleased with it myself.
That is one of my top favorite areas. So for under the eyes, it helps reduce darkness. It helps to improve collagen. So for people like me who are extremely fair and thin skin, and you can pretty much see through my tissue, it actually thickens up that tissue so you can't see all those blood vessels. And because PRF has more cells and they stay alive longer, it actually gives you a little bit of volume to that area versus normal PRP. So it will fill in that area just a little bit. So for people like you and me who have very minor tear troughs, I wouldn't even consider filler because we're the people that it's going to go sideways in and we're going to end up with puffy eyes or it's not going to look good. For somebody who has super sunken under eyes, they may actually need filler and PRF because they just have such a volume loss there. But I would say 80 to 90% of the people I see complaining of tear troughs actually don't have volume loss, or they have bags underneath their eyes and they're trying to hide that. And that's also not a good thing for filler because then you're just attracting more water to an area that already has too much water. So dark circles is one of my favorites. 2, overall skin rejuvenation. So anytime you just have texture, laxity, dull skin, if we microneedle you and put PRF on top, or if I inject PRF, or sometimes, which I know this is a little off topic, I'll take small Pdo threads and insert them. And then as I withdraw them, I'll inject PRF down those pathways so you're getting more collagen. You can treat textural issues on people's faces without having to go into a resurfacing treatment if they don't have the downtime or if they have a contraindication or they're just not wanting that. So a lot of times resurfacings are still the best for texture, but not everybody's ready for it. So I don't like leaving them hanging high and dry, like offer them something. And this is something that you can do to address those textural. So I would say anywhere that skin is lacking luster or has texture, and by texture, I mean fine lines, wrinkles, lumps, bumps, that type of thing, dark circles in the tear troughs. And then my final favorite is hair growth. So when people are having hair loss, you can do PRF or PRP injections to stimulate hair growth. You must, however, first have a blood test to make sure you don't have a hormonal or nutritional deficiency. Otherwise, it's not going to work. So that's my one caveat of hair. I have seen it work amazing with stimulating hair growth for coming back. And some people will use it in combination with hair grafting too. But I always just put the caveat out there for hair loss. You have to make sure there's no deficiencies first.
Right, because if you don't have the building blocks, no matter what kind of stimulator you put in there, there's nothing to help build.
No,
Okay,
losing the hair, yeah.
right. Is the okay, so is the vampire facial, is that basically microneedling and then you put the PRF or in some cases the PRP on top of that?
Yes. Yep, that's what it is. So the vampire facial is where they're microneedling and then they're putting the PRP or PRF on top. The facelift is where they're injecting it into multiple areas.
Got it.
So
okay. I mean,
all over.
I'm sorry, go ahead.
I was gonna say you can inject it anywhere, including O shot and P shot. So
yes, exactly, which is beautiful. That's what the O shot or P shot or the fem shot is basically we traditionally do PRP. Now I haven't seen any studies on PRF. I'd be interested in seeing that. Although
you would just be able to do it. I mean, anywhere that you put PRP, you can substitute PRF because PRF is only taking out the anticoagulant. So there's nothing that would cause harm in any way. You can automatically substitute. So the best way I always say to go look for studies to understand it is actually in the dental industry. They're the ones who first switched to using PRF versus PRP way before we did in the aesthetics. So they were ahead of that. And I believe there was actually a study in China that was done too, comparing PRP and PRF. And at the end of that study, PRF had actually shown increased neovascularization, so meaning increased blood flow in the area, and PRP did not. And one of the things that we're trying to do to create healthy tissue is create new blood flow to the area.
Exactly, so we could deliver nutrients and remove toxic waste byproducts. Okay, yeah, I'm thinking, okay, we're stimulating collagen, but we're not overstimulating abnormal collagen like a scar or a keloid. It's just your body's normal collagen. So with the O shot, you know, we put it into the clitoris, we put it into the spot, periurethral sometimes. So, I mean, all of that would make healthier tissue. And then as far as the face, we're always trying to build collagen that is in a healthy way. So that's really exciting. I'm going back to where you said that PRF has a higher amount of red blood cells. So if you're injecting it under the eyes and somebody has dark circles, you know, sometimes I worry about hemosiderin or red blood cell extravasation where they get the kind of staining of the skin. Do you see that with PRF, or it's just so minimal?
It's so minimal. It literally has only 1 to 2% more red blood cells than PRP.
Okay.
You're talking like a 1% difference, which is very, very, very tiny. The only time it could create that is if somebody was to draw it up wrong and draw up a whole bunch of red blood cells. So the way when I'm doing training courses, how I describe it to my students is when you draw up PRP, it's very clear and yellowish. So I describe it like Chardonnay. When you drop PRF, it should actually look more like rosé. But if it looks anywhere like a Cabernet, you're doing it wrong.
Okay, that's really good. So, I mean, that is an amazing point. And for everyone that listens to this podcast, if I cannot get it across any stronger, things like Botox and neuromodulators and, even these other procedures, they have become somewhat a commodity. And just because someone is doing it, the state laws vary very, very widely. And just because someone is doing it doesn't mean that they are actually trained to give you good results. So do diligence, vet people properly, make sure they've done quite a few of these procedures and they know the nuances and the ins and outs, because it's your body. You really only get one chance and you're worth the investment. So definitely go to someone who's qualified and who knows what they're doing if you're looking into any of this.
Well, and most of the time it's their face and you can't really hide that. So when things don't quite go right, it's a disaster, right? Because it's not like, I mean, of course, nowadays we can walk around with a mask, but depending on where you're putting it, that's what's front forward, and it can be a little bit hard to hide if things don't go quite your way.
No, I know. That's why I want to educate people on this. Okay, so let's go to the protocol for hair loss, because with PRP in the derm literature, everyone does their own thing, obviously, but basically the protocol is once a month for 3 months and then every 6 months. What are you doing and what are you seeing with PRF? And I know that varies a lot depending on what other ancillary things people are doing, but is there a general protocol that people should expect when jumping into this? Just say they're, in their 40s or 50s and a female that's noticing just a little bit of hair loss, like thinning over time, not dramatic male pattern hair loss where they're going to need grafting and transplants.
Yeah, so it is very similar to that. We usually do once every 6 weeks and we do a series of 3 to 4 in order to stimulate that hair growth. We actually combine it with RF microneedling now instead of just regular microneedling. No matter what, you either need to inject it or create holes to put it down. It can go either way. So I've injected it in people. I've also just microneedled and put it on top. So that's completely fine to do in either ways. I've actually done a combination where I will inject the PRF and then afterwards I'll do microneedling over it and add exosomes on top of that. So you can do a combination depending on, number one, how severe is the hair loss and what are we trying to do? So that's your main thing. And number two, what is the patient's budget, right? Because if they have severe hair loss and a higher budget, do it all because you're going to get more. 1 + 1 always equals 3 in the aesthetics. If they have minor hair loss or their budget is lower, then you can decide, okay, I'm only going to inject PRF, or I'm only going to microneedle with PRF, or I'm only going to microneedle with exosomes in order to get that hair growth result and still get them something. But it's also not for people who are completely bald. So if at that point you are, looking like George Costanza, completely bald up on the top, you need hair grafting. But hair grafting, a lot of times they will do a PRF treatment injection a couple weeks ahead, 4 to 6 weeks ahead, basically to fertilize the soil before they go and plant all these hairs, or AKA trees. And then they tell the patients that once they've got their hair grafting result, that once or twice a year, they should do a maintenance PRF or PRP injection to help maintain the hair that they've had grow back in place in order to prevent further loss.
Okay, that's important for people to hear, just jumping back as well. It's not all or nothing. Every you can be beneficial. You don't have to have these extravagant budgets, and you can get some results with some minor procedures, even if they don't fit the ideal routine. Well, that's really, really helpful. So you mentioned exosomes. Can you talk about those and what they are?
So exosomes are slightly different, but coming from that same family of where we want to use growth factors and some of the different parts of our body that stimulate growth and heal. So exosomes, the easiest way for me to explain them is they're like an avatar of a stem cell. So we all know about stem cells and that actually using and experimenting and injecting stem cells is not FDA approved here in America. So we don't get to do that. However, how stem cells work is they send messages to other cells to do what they want them to do, to heal that tissue or repair it. Exosomes are that message. So the stem cells release these exosomes, which are they're acellular, they're little pods just full of some stuff, including growth factors, and they go and plug into the cell and tell it what to do. So that's why I call it like the avatar, or basically it's a message coming from it. So these exosomes have been harnessed from stem cells that are adipose derived, meaning we got them from fat tissue. There's different areas that you can get stem cells from. Fat is one, bone is one, placental tissue is another one, but these ones are specifically adipose derived stem cells that have produced these exosomes. And then the exosomes are bottled up and they live in our fridge. And when a patient comes in, you open a new bottle, mix it up with hyaluronic acid, and you apply it on topically, meaning now in states where estheticians or laser technicians are allowed to perform microneedling procedures, they can apply the exosomes because they don't have to be a phlebotomist or bloodborne pathogen certified like you do with PRF in order to draw the blood and apply it back on top.
Okay, so my understanding is that exosomes, as opposed to just say you're 50 or 60 years old and you're having your blood drawn, your cells may not be as actively stimulating what we want as an end result than where these exosomes are derived, which are from 20-something-year-old
23 and 24. It's either 23 and 25 or 23 and 24 were the donors. So you're right. It's young 20-year-olds.
Okay, but these are not injectable. They're only topical.
Correct. The particular brand that I work with and use, which is Benev Exosomes, they are a skin care product, or like that's how they're certified. So it is topical only. It is not to be injected, which is why PRF is still a big part of my practice, because I inject it. If I'm treating somebody's dark circles and hollow tear troughs, I'm injecting PRF. If I'm doing an RF microneedling like a Scarlett or a Silpharm X, I'm applying exosomes on top because it's my laser tech who did the procedure. She can go grab those exosomes and apply them quick and easy. And then the other benefit of that is you don't have to get a blood draw, because if your patient is not a good blood draw and you are not good at drawing blood, that creates an issue.
Come back. So, but there has to be damage to the skin or microneedling holes in the skin exosomes to penetrate. This isn't something you're going to buy and apply to your skin and have the creation of collagen. So
it's not a topical skincare product in that way, but it's registered like that so that we're able to use it topically with procedures. But you are correct. There has to be skin damage. They have to be resurfaced, or they have to be microneedled, or there's been people who have had bad wounds, like a burn wound, or it was Dr. JD McCoy who had a patient come in for a totally different procedure. And she had this wound on her lower leg that was not healing. She had been to, I believe, John Hopkins and Barrows, and she had a medical file that was like this thick of them trying to do everything and tried all these different antibiotics. And it was just this wound that wasn't healing. And he basically told her, I know you're here for other aesthetic procedures, but I really can't treat you with a leg looking like that because I'm worried about your health in your leg. Let me try putting exosomes on it. So he brought her in once a week and put exosomes on it. And within 4 weeks, I mean, the wound was healed up and almost like closed. It was insane. And he has before and after pictures. He's presented this as part of like a study, but it's really a testimonial. And of course, then the patient at the end was frustrated because she's like, why did not a single other doctor even tell me that this was an option? You know, and really, in reality, the exosomes we're using are only in the aesthetic world. They're not using them for that, but it was an open wound. It healed it. You know, it attracts the body's immune system there to heal and close that wound. And it actually did that job.
Really, I know. And it's exciting. It's exciting to be in the industry and find other indications for these things once you know the method of action, right? But it's always something to do and expand the, the industry. Okay, so back back to something you mentioned earlier that I think is really exciting. So people talk about, oh, these liquid facelifts, but I think what you're doing is really a liquid facelift if you're doing thread lifts with PRF. Can you explain that and what kind of results people get, what kind of downtime they get? If you have time, I know we're over, but I want to pick your brain a little bit more.
Well, it's actually a good time because I'm going to leave you with a little bit of a note that is, I'm not going to release all the information on it because it's not necessarily mine to do, but you are correct that this can be done as a liquid facelift. Actually, when I went to the American Academy of Anti-Aging and Aesthetic Medicine conference in this last December, which was just December of 2020, or no, 2021. That's right. We're in a different year now. Dr. Anil Rajani was releasing an information and showing before and afters of all the research and injections that he had done with something that they are calling Easy Gel, which is a new format or a new procedure that still is involving PRF or PRP, where they're drawing one tube, cooling it, drawing another tube, heating it, mixing the two together, and it actually creates a gel type product. And depending on how many syringes the patient needs overall face, you can inject it all over. So for example, when we say liquid facelift, a lot of times that means dermal filler, like a hyaluronic acid or a calcium-based filler. And a lot of times in a true liquid facelift, you're looking at 10 to 12 to 13 syringes, right? So most of our patients that come in are buying 1 or 2 or 3 at the most. And if they want this liquid facelift, if you've ever watched like Dr. DeMaio do his, when he did his big webinar during COVID, he did 13 syringes on the patient for the liquid facelift. And when done properly, it can look great.
Let me explain to the listeners what that actually costs for the budget, because I think it's perfect.
Yes. Well, typically syringes are running anywhere from about $600 to I'd say $1,000 a syringe, depending on the kind you're using, times 10 to 13. So, I mean, you're getting up there pretty quick. So with this Easy Gel, depending on how we draw it, we can also end up with anywhere from 6 to 12 cc's. Each syringe filler is a cc. So that would be equivalent to, again, about 6 to 10 to 12 syringes, and go in and fill all these different areas. So we can do cheeks, we can do tear troughs, temples, you know, anywhere else. Obviously, some of this is injection areas that are off label with fillers as well, but it would be applying it anywhere that you would be applying filler. And it seems to be, my stuff arrives on Monday, so I don't have it yet, that patients are getting more of a fill and an increased volume with the Easy Gel versus PRF on its own. And Dr. Rajani did have before and afters actually done with a special camera system that overlays it, and the camera identifies changes in height of the tissue and highlights it in color. So, I mean, he did have some very impressive before and afters to show that. And again, all this is a blood draw for the patient. So it's 100% their own tissue that's natural, that's injected back in. So the combination of doing something like an Easy Gel with some Pdo threads would create a very natural looking, but still give you that liquid facelift result.
That's beautiful. Do you mind just explaining what Pdo threads are for everyone? Because I have not discussed them on the podcast.
Yeah. So Pdo threads, in a short version, they're made of dissolvable stitches or dissolvable sutures. Basically, it's the same type of suture material that they would use in cardiac surgery to sew the vessel back on, or in a C-section to sew the uterus up. Because you have to sew the uterus up, then you have to put the uterus back inside the body, and then you have to sew the body up after a woman's had a C-section when having her baby. So they have these materials, this one's called Pdo or polydioxanone, that they would suture it up with. That's longer lasting, but it breaks down so that, you know, this woman is not left with a permanent foreign body or foreign object in her body, right? So the suture material breaks down over time, but also, you know, it's not like other stitches that you can go to the dermatologist and just get them cut out. It's not like we're going to cut you open to take the stitches out of your uterus and then sew you back up again. So that's why somewhere along the line, somebody created this amazing material that dissolves over a 6 to 8 to 12 month period, so that the person's not left with a foreign object, but it stays intact longer in the body to make sure, for example, that that uterus is completely healed shut before it dissolves. So in Asia, they were doing facial acupuncture, and somebody wanted to leave something along the acupuncture tract to stimulate it more. Somebody else had the idea to put a Pdo thread in, and long story short, birth of PDOs, because they found on biopsy that as the Pdo threads break down, they leave collagen in place. And so that's where these came from. And short version, there's two kinds. There's little smooths that are for texture, stimulate collagen, and there's bigger barbs that are called lifting threads that we actually use to redrape the tissue back. And so depending on what a patient needs, I use a little bit of both in different areas, but that's the short version of Pdo threads.
Okay, so as you're listening here, Dr. Ann's talking about the smooth, which are like for the little fine lines around your mouth, and that's what she's pointing to, and then the barbed ones that are more of lifting and pulling.
Yeah.
Okay, that's beautiful.
Or I always say my favorite indication for smooth threads is the glabellar frown lines. After somebody's been doing a Botox or neuromodulator and they still have those frown lines, putting filler there is very dangerous and can lead to blindness, but you can use Pdo threads there safely to fill in that texture line. That's what I use those little smooths for, because now I can get the patient the result they want and I don't have to worry about blinding them.
So. Yeah. Very low tolerance for risk when we're dealing with cosmetic procedures. Actually, anyone experienced in the aesthetic industry has a low tolerance for risk, and we try to creatively come up with other options that won't cause problems or permanent issues for our patients. Yeah. So how about raising the brows? Can you do that as well for like a brow lift?
Yep. I can do them both with barbs and smooths, depending on how low the brow is and what the person is looking for. The very popular brow in this day and age is that cat eye that our younger population will come looking for, or that flared brow. So you can even change the shape of somebody's brow if you want to.
Okay. And it's permanent?
Nope, it's not permanent. So Pdo threads, remember, they break down over time. They were designed that way to break down over a 6 to 8 to 12 month period. So I just sell them to my patients like filler. It's like a once a year type treatment.
Okay, good. I asked that rhetorically because, with these trends, especially with eyebrows back in the day where people were plucking, everybody has eyebrows. So it's, if you want to have that cat look, but then you don't want it in 5 years from now, this is kind of the way.
Which is really nice, because it's funny. Dr. Rajani was talking about that on his, when he was showing the demo for the Easy Gel, which is like a PRF, that, back in the 80s, everybody was having their eyebrows laser hair removal off to these thin ones. Now they're all back in, repaying money to have PRF injected to grow the hair back.
The dream I had that we talked about, where I had a dream that the full bush was back. And many of us we're not going to go hair transplant.
Nope, we're not. Definitely not doing that.
Think carefully before you do anything permanent. But this is amazing. I love this conversation. I know we're completely over. I love your brain, and you're always on the cutting edge of everything. Your office just is whatever is out there before I even hear about it. You already have your hands in it. So I thank you for what you're doing. And how can people find you?
So there's a couple different ways. Obviously, if you look up our website, which is clearskininstitute.com, there it will have our address, our phone number, everything like that. You can always follow our podcast. So that's What Would Larry Do? You can find that anywhere that you would listen to podcasts normally, whether it's on your Apple Podcasts, Spotify, and it's the big orange C for Clear Skin, so you can't miss it. And then we also have a YouTube channel that's Clear Skin Laser. So it's a little bit different, but basically if you look up Clear Skin Institute or Clear Skin Laser, that's where you can find us and contact us.
Great. Thanks, Dr. Ann. I really appreciate you.
Great. Thank you. Have a good day.